The world watched her grow up as Half Pint on the popular TV show Little House on the Prairie. But as she grows older, Melissa Gilbert says she wants to embrace aging. The actress is swearing off Botox and fillers and even removing her breast implants. She's one of the few in Hollywood saying no more to plastic surgery.
You will find every once in a while someone who is maybe looking to gain more media attention or something like that will make this drastic announcement that they're no longer going to embrace plastic surgery. And that's fine, to each her own.
Plastic surgeon Tiffany McCormack says what's right for Gilbert doesn't have to be the norm for every woman who hits 50. She says it's okay to gently turn back the clock using plastic surgery.
In this day and age, we have a lot of ways to do that very naturally without making people look pulled or plastic or fake.
Experts say that's what many women in this age category want. They don't want to roll back the decades of living. They just want a few tweaks. They just want to refresh and maintain a youthful appearance.
It's okay to have a little bit of gray hair. It's okay to have a few wrinkles, as a matter of fact. Some people may like more than others, but they don't need to look like a different person. They want to keep their identity.
Dr. William P. Adams Jr., who is the founder of the Plastic Surgery Channel, says for most people there is a desire to look good well into their 60s and even 70s. And he says it's possible to preserve with a healthy lifestyle and improving techniques in plastic surgery.
There's some very simple things that can be done using some very good techniques, both surgical and non-surgical.
Adams says it's important to communicate with your doctor about how much change you want and find a doctor who's willing to listen and help you reach your goals.
Most people in this era want to grow old, but grow old gracefully.
For the Plastic Surgery Channel, I'm Dawn Tongish.